A new study on Medicare for All was released, and it's winning so much it's making my head spin. So this is, Jacobin is reporting on it here, but you're about to see where the study originated. Let's take a look. They say Medicare for All advocates just received an early holiday present. A new study from the Political Economy Research Institute, PERI, at the University of Massachusetts-Amherst, finds that single-payer healthcare will save the U.S. $5.1 trillion over a decade while drastically cutting working-class Americans' health spending. It's the most robust, comprehensive study yet produced on Medicare for All, which has long been in need of easily citable research. All right, let's pause there. Now, the study that's been cited most to this point is the Mercatus study that's funded by the Koch brothers. So it's a right-wing study, and let's be clear, they went into that study trying to prove that Medicare for All would be a disaster. And in fact, some of the headlines coming out of that study were, Medicare for All would cost $32 trillion. And they're trying to scare everybody. Oh my God, $32 trillion over a decade. We can't afford that. But then when you actually read the details of the study, they say, yeah, our healthcare system, if we don't do Medicare for All, would be about $34 trillion. So there's a net savings of $2 trillion. So that was the number that everybody's been using, including myself, is, oh my God, it would save $2 trillion. Isn't that great? But I added the caveat oftentimes that I'm not sure that's even the correct number because it's funded by the Koch brothers, this study, and I don't really trust it. Well, now we have a better study, and this is more in the ballpark of what I would expect. $5.1 trillion saved over a decade. So, seems like good news to me. Let's continue with the article. The study analyzes Senator Bernie Sanders' Medicare for All Act from top to bottom, elaborating on several key aspects of the bill, including what the transition to a fully public, comprehensive, free-at-the-point-of-use healthcare system might look like, and what impact the program will have on U.S. residents. Most significantly, it answers the most common question single-payer advocates face: how will we pay for it? The findings are impressively thorough, reaching nearly 200 pages in length. The report has been praised by health policy experts for its sound methods and clarity. Allison Galvani of the Yale School of Public Health predicts it will become recognized as the seminal analysis of Medicare for All. Long plagued by accusations of ambiguity and impracticality, Medicare for All now has credible economic research its advocates can cite to supplement their core arguments. That single-payer healthcare will be a major working-class victory, that it will save lives, and that it will represent a seismic shift toward a more just, solidaristic society. Now, the thing that always drove me nuts is that the mainstream establishment bubble wisdom, the conventional wisdom, is pie in the sky, unicorn, lefty nonsense of single-payer healthcare. And really, that what everybody would say was the exact opposite of reality, because we aren't the only country that exists in the world. Other countries exist, and there's detailed evidence and data from those countries to parse through. And the reality is, every other developed nation has one version or another of a single-payer system. And when you look at every analysis done, they kick our ass. They kick our ass in every measurable way. So even the most recent study that I've seen, the Commonwealth Fund study, ranks the U.S. They looked at 11 developed countries, looked at their healthcare systems. The U.S. ranked 11 out of 11. So we spend more. We leave 28 million people uninsured. 83 million people underinsured, by the way. And we have worse health outcomes. So you spend like double what the other developed countries pay, about double, and you get worse health outcomes. And medical bankruptcy is one of the top causes of bankruptcy in the U.S. that doesn't exist in other developed countries. So, in other words, this isn't even a tough question, but the DC bubble wisdom is the opposite, where they act like, well, obviously we have the best healthcare system in the world. No, we don't. There's no study that says that. No study. They act like that, and they also act like, I can't believe, lefties, how are you going to pay for it? 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 Hey, dipshits, it would save $5.1 trillion. So, and the argument goes, and this is where we saw Bernie Sanders was smeared from CNN and other places, back when there was a primary debate or whatever it was, town hall or whatever. He said, under Medicare for All system, yeah, your taxes will go up, but you net save money because we'd eliminate your private premiums, and that you would net save money as a result of that. What did they do? They clipped out Bernie saying, yeah, your taxes would go up, and stop there. They didn't give the rest of the context. But you would save money because we get rid of your private premium. They got rid of that. Totally took it out of context. But that's what the establishment does. They smear. And they flip the truth on its head. Meanwhile, every other developed country looks at us like we're in the fucking Twilight Zone because we are. We know that single-payer systems are better. We know it's not even a question. And the fact that we're debating it is honestly sad. Like, it is legitimate. Like, even with the political class pushing their propaganda nonstop, we're still at the point where 70% of Americans are like, yeah, we want a Medicare for All system. You want to know why? The propaganda is no longer landing. Because there's been a lot more education on this issue happening. And so people are realizing, oh shit, we've just been wrong, we've just been lied to this entire time. Our system blows, and we can fix it. And it's just a matter of being bold enough to try to fix it. You know, it annoys me when people act like, oh, we're the number one, we're the best country. And then when you say, like, oh, maybe we should try to be number one in healthcare and do a Medicare for All system and cover everybody and make it great. And they're like, no, we can't do that. That's too ambitious. No, we should do that. So, awesome new study. By the way, I'll leave the link to the study in the video description box below, and you can take a look. They go through immense detail in this article where they talk about, hey, here's how the exact taxes to pay for it, and here's exactly where the savings come and how they come about and all that stuff. So you can take a look at the details of that. But suffice to say, this isn't surprising to you guys, but it will be to some who might not know about this issue yet. This is the way to go. It's not even a question. There is no counter opinion that's even somewhat viable on this issue. The debate is settled. It's kind of like climate change in the sense that it's not debatable, but they try to debate it. It's the same thing with this. It's settled. It's done. And you look silly if you try to fight it, and history will not judge you kindly.